My name is Dr. John Saunders, and in this video, I'm going to give you a simple thing that you can do at home to alleviate or reduce a bout of vertigo or dizziness. If you've ever experienced a bout of dizziness or vertigo, an acute bout where you've just lost it, you know it's scary and debilitating. If you're familiar with my channel, you'll know there's many videos on how to treat and help yourself with a variety of different causes of dizziness or vertigo. And if you're new to my channel, you might consider subscribing to my channel so you can be informed when I upload a new video for you. This technique I'm going to show you, I've taught to many patients over the years to help them get rid of or at least reduce that feeling of helplessness when you're struck with a bout of vertigo or dizziness. While it may not treat the cause like some of the other videos I have on my channel, it will at least give you some control so you can reduce or eliminate that bout in the comfort of your home. However, this is my caveat or warning. If this is the first time you've experienced a sudden onset of dizziness or vertigo and you have no idea why you have it, please seek medical care, as sometimes dizziness or vertigo is a medical emergency. So please don't ignore it. I will always encourage my patients and viewers to find the cause of your problem so you understand the cause and can safely and effectively treat that problem in the comfort of your home. Okay, let's get to it. Now I want you to practice this. I'm sure you're probably not experiencing vertigo or dizziness right now, but be ready for it so you can apply this technique as soon as you feel a bout surfacing or starting. So we're going to focus on acupuncture or acupressure points to help mitigate a bout of dizziness or vertigo. We're going to focus on 2 points: PC6, which is pericardium 6, and ST36, which is stomach 36. This routine will only take 2 minutes. We're going to go 30 seconds on 2 points on both sides of our body. You can work through this once and repeat as necessary, but I know if you find these points correctly, I think you'll notice a big change in your dizziness or vertigo. So pericardium 6 or PC6 is great for things like nausea, motion sickness, vomiting, vertigo, and dizziness. We're going to find it by placing our 3 fingers on the back side of our wrist. And what we're going to do, we're going to measure it basically at our 3 fingers. We're going to come right in between the tendons of the palmaris longus and the carpi radialis. And we're going to find that point, and we're going to put some sustained pressure, almost like a trigger point. We're going to hold this for 30 seconds. And it might take you a few tries to find the right point, but just give yourself some grace and patience. You'll get it. And just sustain that pressure. We're going to hold it for 30 seconds, and then we're going to move. I have to take my watch off. And then we're going to move to the other side. Again, 3 fingers, thumb, and just gently press into that area, holding for about 30 seconds. This will be followed immediately by stomach 36. ST36 can be used to help with things like nausea, vomiting, abdominal pain, and of course dizziness or vertigo, which we're talking about now. In order to find this, we're going to just palpate down, and you're going to feel the tibial tuberosity, and we're going to come lateral to that. Another way to do it is just take your 3 fingers, cup your kneecap, and you'll find that the outside finger will kind of get into the area where the meaty part of the tibialis anterior muscle, and you're going to find that point. And again, you're going to sustain some pressure there for about 30 seconds, and you're going to hold it. Sometimes people find benefit if they kind of massage around that point. And again, we'll do that for 30 seconds, and then we will switch sides. So again, 3 fingers, kind of in the meaty part. And again, you might feel some tenderness in that area, so that might be a good indication that you are on the right spot. And simply hold this for 30 seconds. Some patients that I've given this to, they get effective relief just by using 1 point, either the ST36 down here or the PC6 here. Everybody's a bit different, but I know if you experiment a little bit, you're going to find some relief from dizziness or vertigo the moment you start stimulating these points. So tell me what you thought in the comments below. If you have a question, please leave it in the comments below and I'll do my best to answer your question. If you have an idea for a topic, leave that in the comments below too and I'll add it to my list for a future video. And as always, if you like the video, please hit the thumbs up and consider subscribing to my channel. I'd really appreciate it. I can't wait to see you in my next video. Until then, stay well.